In a situation whereby 700 ophthalmologists are saddled with responsibility to care for the eyes of more than 200 million Nigerians, it is hardly surprising that over 4.25 million adults in Nigeria aged 40 and above suffer from moderate to severe visual impairment, otherwise known as blindness. At present, available evidence suggests that over 2.2 billion people are visually impaired, and ophthalmologists have warned that the number of people with vision loss is expected to rise from 1.1 billion in 2022 to 1.7 billion by 2050, adding that aging populations and increased prevalence of non-communicable diseases such as diabetes could exacerbate eye health issues in years to come. Like I told you earlier on, an ophthalmologist is in the studio to have this conversation with us on the rising incidences of eye-related issues in Nigeria. Dr. Obinna Shiweobi, a consultant ophthalmologist. Thanks for having you.
Yeah, good evening, viewers.
He's of Alex Ekweme Federal University Teaching Hospital, Abakaliki, Ebonyi State. And now over to you, Quinsley.
Okay, just to have an insight of what naturally causes eye-related issues.
Okay, thank you so much. The first is that, well, there's an increase in population. There is a worsening inflation in Nigeria. We are aware that when we were growing up, we were used to outdoor activities and sporting activities. Currently, our children move from home to school, and most of these schools are private schools that do not have playing fields. So the children play indoors, and then children are now very much used to using laptops, tablets, phones. If you want a child to stop crying, you give the child a phone, play a cartoon, play a cartoon in the phone, the child goes to keep quiet. So the child knows that, oh, this is a way to pacify this child, so this child keeps doing it. So our children are now very good used to near walk, and then hardly do they do outdoor activities. And now in this, because then there's now an epidemic of myopia, which is a short-sightedness, which is a part of refractive error. You know, so in our time, hardly do we see children wear spectacles, but it's a common thing now. You see children wearing spectacles. Then we talked about inflation. We know what's happening in Nigeria. You know, with poverty, you know, being used as a weaponized tool, more people are coming, you know, with malnourishment, and this also increases eye cases. Very importantly, there's an increased awareness by the ophthalmologists on everybody to go and check his or her eyes. Okay. And then as they do this, more conditions are seen and then be managed. So these are just what actually leads to all this. You know, there's an increased number of eye cases, and then I wonder if the number of specialists are increasing or dwindling because of the Japa syndrome.
Now, you mentioned poverty, and I was wondering, perhaps that's why I have myopia too.
No.
And I've had this for as long as I can remember.
Yeah.
So, but I'm trying very hard to connect economic situation with eye.
Okay, so economic situation is not, what has to do with myopia are children growing up and have to do with mostly near things. Laptop, tablets, and phones, you know, and then so they are almost always glued to a screen.
But is that for myopia?
Yes, that's for myopia. Now,
but back in the day when there were no such privileges,
yes,
you know, there were televisions.
There was myopia. You know, myopia comes from so many causes.
Oh, okay.
You know, but we can't compare it to now. Now there's an epidemic of myopia. You know, I don't know if you could just go to highbrow secondary schools or primary schools and see how many children. You see more not wearing than those who wear glasses.
Comparatively, the trends of vision impairment with Nigeria and the rest of the world?
Well, comparatively, the third world, we are more besieged with preventable causes of visual impairment and blindness.
Preventable
Yes,
causes.
preventable. In our area, the commonest cause of irreversible blindness is glaucoma. Now, in civilized world, the commonest cause is what we call age-related macular degeneration. In our environment, you see more of vitamin A deficiency and all malnutritions coming on. In the civilized world, you have more of this myopia because of they were prior to us now becoming that this was what their pattern was. And then we enjoyed fresh food, fresh fruits, and then there's also an increase in diseases like diabetes mellitus, because of increased working hours in a bid to make more money, and then people tend to do sedentary work, stay in one place, and then nobody does eat fresh food anymore. So it's more of
stored,
refined,
refrigerated.
yes, refined, refrigerated, stored foods, that our people are now getting used to. Now, what we're not used to are now, so there's a trend that we're now becoming like the whites, so that those things that plagued them are now albatross, so we're not suffering them now.
So what environmental or occupational factors contribute to eye health problems in Nigeria?
Okay, very good. Environmentally, a place like, let's give you a place like the North, where you have dry, dungy weathers, trachoma prevailed. But currently there's a good job being done there now. In our environment, you wouldn't just say much of what we have here is actually more of genetic predispositions, and not the environmental issues. Where you have more of environmental issues are in the North. Here, we suffer more of like the glaucoma mentioned, which is more rampant here, more prevalent here, is mostly a genetic position of the Igbo tribes.
Oh, really?
Yes, the Igbo tribes. The trachoma I mentioned earlier is mostly environmental, having the cows, the passivisis, and the flies perch on them, and then touch the eyes. We hardly have such things here. We don't have such prevalent circumstances.
But by here, you mean what? Because
we have the southeastern
view.
Nigeria, the southern part of Nigeria. We don't have that dry weather, that makes those flies, perch on dungs, on the cow dungs, and then perch on the eyes too. It's difficult here, that's environmentally
So
speaking.
what's occupational factor?
Well, occupational factors will have been, for us who are farmers, we have a majority of our people who are farmers, who, as they till the ground, they raise dust, and then those dust touch the eyes. One, they cause allergies. Two, they predispose these people to what we call pterygium. You see a flesh moving from the white part of the eye to the black part of the eye. These are. Then, very importantly, we're under the sun. So that pterygium, the pingaculum, they all prevail because of our environment.
You talked about the Japa syndrome. You said you weren't certain that we have enough eye specialists to go round. And so that could be a problem when it comes to, and that could even be the reason we're having rising incidences of eye-related issues. Or apart from poverty, I'm looking at poverty from the angle that people are not very much concerned with, their eye health. I mean, nobody wakes up and walks into the hospital to have their eyes checked just for the heck of it. Okay, you have to battle a lot of things, and you would also give considerations to the financial implication.
Yes.
But this other issue of not having enough ophthalmologists to go round, and other eye specialists, as well as facilities too. Could that be one of the reasons we're having the prevalence?
Yes, well, we are doing our best to cope with the number of people that come. I don't think there's anybody who will say doctors are no longer there. Doctors are there. It's currently the Nigerian Medical and Dental Council, I think, even doing a work trying to increase the number of intake of medical students so that we can have many medical doctors. But importantly, it's also the training, apart from being MBBS holders, also to train to become specialists, Now, we have numbers. Many have gone. Many are coming up, Nigeria may be like India, that the oil is pushing out personnel to the developed world. Once they are well trained and skilled, they will fall back to India. Now, in Nugu, Nigeria may come to that. You can see that most of our well-trained specialists abroad are now thinking of coming home. Because, one, if you can make Enugu the hub of, let's say, glaucoma surgeries, where everybody will be coming here from South Africa, from Kenya, from Morocco to come and have their surgeries here, because they feel that you have the facilities, and therefore, they tend to come. So I think that's where our people are moving to now. So the Jackman syndrome I mentioned is just that, yes, it's happening, but there's also that attempt to also beef up the number, they say nature abhors vacuum. So as people leave, people also take over. The only people that suffer are those in the rural areas, because the people in the rural areas initially were there because they felt the urban areas have been taken over by a lot of specialists. So they now tend to go to suburbs and then the rural areas. Now, when those who are in the urban areas begin to leave, they tend to leave those places in the suburbs and rural areas as outlets, while they fall back to the city where more people can access their services. So this is actually what happens. And that's why maybe we don't feel it, because people tend to, so the people that may suffer more are those in the rural areas.
How about adequate facilities for
Well, adequate facilities, I would just say that the government has not been helpful. That's the truth, in providing what we require, so that the brain drain, the
Jackman syndrome?
No, the medical tourism will be stopped, I have had people call from outside the country, please, do you do this? And I say, yes, we do. And you know why? They want to come back because it's far cheaper here than there. One has called about his mother-in-law having cataracts. I said, no, come here, we'll be well done here. That come here and there are the same, and you can't compare the cost, the facial cost. You can't compare.
There's a clear difference.
There's a clear difference. You can't
because
compare.
of foreign exchange.
Foreign exchange, yeah, so it's cheaper here, Now, we feel that if only the government can do the needful, okay, I was sent outside the country, India, trained, and I was promised everything will be given to us when we come back. Yes, some were given, but not as much as we, expected, Unlike the private eye hospitals that are doing well in trying to provide all the fuel are necessary for our people. And therefore, they reduce the medical tourism. People tend to, I've gone to an eye clinic where I saw a patient and said, if she ever knew that we had such in Enugu, she wouldn't be going to the UK for medical checkups. Not only her, many people have said it. So, private enterprises tend to do what government should be doing. I think that government should ban civil servants embarking on medical tourism. Everybody should be stopped from, government should not pay for anybody going abroad for treatment. In that way, government will be forced. Government will be forced to do the needful, to provide the needful. Now, if they know that this is their last bus stop, that if it's not provided, they won't get it. They will provide everything. Everything will be provided here. So this is our prayers that government should actually should actually equip these hospitals. We have personnel, but the equipment are not there. That's also what also gave rise to the Jabba syndrome. You know, those who feel trained feel they don't have what to work with. And then when I came back from India, I mean, we didn't have lasers in the government school that sent me out. But I could do lasers in private establishment because they were able to provide it. And it made sense to go do lasers for them. Now we are praying that the government should provide those things so that our people can access them at cheaper rates, cheaper and affordable rates. So this is our prayer that the proper thing should be done.
So what challenges really limit quality eye care services, especially in the rural areas?
Wow. Well, electricity, accessibility, insecurity, and then the economic powers of these people who live in the village. Can they afford it? Except those who have wealthy children who can actually pay for it. They can't really pay for it. That's the problem. When you move your services to the rural area, even the indigenes feel that our brother has brought free services to us. If they are told that no,
You have to pay.
yeah, you have to pay, and they want to remind him, was it not your father that we all sold our land to send abroad to go and for scholarship? Why do you want us to pay now? Forgetting that every private establishment must survive. It must be sustained. It must survive this time. If it's not sustainable, then don't do it. So, for you to move it to the villages, you must have some sponsors, people who are going to back you up. Provide you free drugs, provide you free consumables, provide you, everything that you need. But if government does the needful, I'm telling you, provide access road, provide very important security. We tend to be more secured in the urban areas than the rural areas. You wouldn't want to go to a place where at every time the children will just come, knock, carry you, enter the bush. The hospital pays all that they have earned in the last 1 month, then they release you. After 2-3 months again, they've wasted the money. They come back again and pick you. No, nobody wants that. So these are the reasons why people will not even go there.
Okay, for the reason we're having rising cases of eye-related problems, is it that people are not really aware? Is it about awareness? Is it about
No, I think there's there has been this when the survey for the visual impairment blindness survey in Nigeria came out, and the Southeast had the worst prevalence of glaucoma and its consequences, that is visual impairment and blindness. Excuse me. The ophthalmologists in Southeast had a meeting, and we agreed to do the needful to change the narrative, create appropriate awareness. Let everybody go have his eyes checked.
Before it gets to that level? Okay, so you're saying that glaucoma is one of those preventable eye...
Yes, no. The primary glaucomas are not preventable. Secondary glaucomas are preventable. But the visual impairment and blindness from glaucoma are preventable. Like, you may not prevent having hypertension, but you may prevent stroke. You may not prevent diabetes mellitus, but you may prevent amputations. Do you understand? I can take my water then.
All right. Still on issue, I would like us to take a short break. When we return, we will continue this conversation with Dr. Obinna Shiweobi, consultant ophthalmologist who is from Alex Ekweme Federal Hospital, Abakaliki, Ebonyi State.
Every second, every minute.
We're still having this conversation on rising incidences of eye-related issues in Nigeria. Dr. Obinna Shiweobi, a consultant ophthalmologist. You talked about children having more screen exposure, and you're not wrong with that. I think that's the in thing now. From home to creche to schools, they are exposed to screen with the light and its consequences all the time. And so, are there specific eye health risks emerging from this?
Yeah, we talked about the myopia epidemics, coming from that. And then, apart from that, we think about the general health of the child who is overwhelmed. Okay, the child leaves the house to school, gets to school, and the child is overwhelmed with assignments and homework. This child does not see reason to go and play. This child starts assignments during a sports period. The teachers are happy that Emeka is
fully engaged.
Emeka comes home, and what he's worried about is the assignment, the load of work he has to accomplish, he has to get done. You have to pursue Emeka to sleep by 11 p.m. or 12 midnight. And Emeka sleeps, and then parents who are also workers have to get the children woken up by 6 a.m. Get them dressed so that by 7 they are out. In some places, 5:30 a.m., these children are already awake. So this child does a lot of near work, not outdoors, no extracurricular activity, So what do you expect? This child is already used to near things, and you see the child starts having difficulty in appreciating distant objects. In our time, we come back, most of what the teacher has taught is enough for the day. And the assignments are doable. You do them, you don't bother your parents. You just show your dad that you've done it. It's okay, good. Then when we come back, we'll go fetch water, we'll go do one chores or the other. We'll go play football, do you understand? And come back home. So that was what I said. In our times, in our time, it was difficult to see children wearing spectacles, Those who wore spectacles are actually children of the rich then. So it's just what we said. Now, one fact I wanted to mention about was the rising, there's been this increase in, I don't want to use the word quackery, but increase in social media talking about what they do not know about. Somebody will do a video and go and get pawpaw tree and boil it and tell you, boil it, leave it till the morning, sediment it, put small shot of kai, then when you put it in the eye, it cures this.
To cure your eye problem.
The most embarrassing part, and undergraduates and people that should be graduates, people who should be learned, using urine, apply urine in their eyes. It becomes very embarrassing. When they come, I just tell me what you used. And they will put their head down and tell you, I use my early morning urine. And I'll ask them, who told you that urine is medicinal? It was my neighbor. And I would say, that's your neighbor is unlikely to use urine in his or her eyes. Why are you people so gullible? Who told you this? Why don't you ask a medical personnel? Why do you just go, if you need to repair your clothes, you go to a tailor. You need to work on your car, you go to a mechanic.
When it comes to your health.
Yeah, when it comes to your health, you now go to a mechanic. And he will tell you, no, don't do that. I was taught this, so these people eat your money. So there has been an increase in quackery based on what we said earlier, inflation, poverty.
Dr. Shiweobi, what you just described has always been there.
What is that
where we have Dogaman. I don't know if you have ever heard this. It was so much here in Enugu back in the day when we were using public transport to school. Have them sell drugs in
Yes.
the vehicle, and they get one particular medication and it's cure
Cures
all.
everything, yes.
Okay, so it's not recent.
Yeah, it's not the same, no, but it's all I said that there's an increase, you know. If people are doing well economically, if the economy is doing well, people tend to, we see, we all place a good premium on our lives, though. Just that when things are difficult, you know, you see a lecturer whose salary has not come, or who is not going to a chemist to buy unbranded medication. You know, you want, what the child needs is augmentin. You ask yourself, are you ready to cough out 21,000 to, 16,000 to buy augmentin? Or can you buy unbranded ones at 5,000 naira? You know, you see yourself going there, chemist, how much is this? You know, until you see the one that you feel, 5,000 naira, okay,
Could work.
it can work. You know, so now there's an increase, you know, because of poverty, people tend to do things that are not proper. I say there's an increase in quackery, you know, and then people tend to do things. My grandfather taught me this. Now, what your grandfather taught you, why don't you just do it yourself? But you won't do it. You now come do a video, you know, and my God, and nobody does anything. You know, this social media is not censored. You know, somebody can come and put up a very dangerous information, and nobody does anything. You know, if you do, the way the society will look at you, they will tell you, does it concern you? That is a man's business. Let him do it. You know? So, apart from what we just said earlier, this is also an increasing part of what is burdening our society now. You know, there's quackery in town, misinformations, and people tend to take what is feel is cheaper for them. You know, nobody wants to spend money. Nobody wants to waste money. You know, that's just the truth. You know.
So what policies or initiatives do you think the Nigerian government could adopt in order to curb the rising, the increase in this eye problem?
Well, first, I think government should increase the NHIS, that's the National Health Insurance Scheme, to cover so many people. You know, the market woman who sells tomatoes should be able to access healthcare. Government should actually government is trying, you know, to pay the doctors, the nurses, the health workers, just like the universities too. We also think they should do more, you know, spend money wisely. Government, if you put in health facilities, everybody benefits. And then you too will benefit. If the governor uses Park Lane, just know that more people come to Park Lane. And because he uses Park Lane, who wants to make sure that the Park Lane is well equipped, it should be world standard. Governor is talking about a medical complex, a medical where more people, you know, with so many facilities that people from outside the country will be coming to access health. The governor is already doing well in Enugu. We pray he goes to that extent, you know, to ensure that the primary health care centers are well equipped. We have community health workers who man these primary health centers. They should be well trained in management of eye care, in eye diseases. They should be well trained in everything about the eye. Not only the eye, but they should also be trained in taking care of pregnant women, managing children, managing acid pouring into the eye, or whatever pours into the eye. I've been able to advise the community people very well, because these are the closest to the masses, you know. So if you do that, many more people will benefit. Then if you can actually put subsidized medications to the health centers, it means that they wouldn't go looking for cheaper ones, or using their urine, or using breast milk. You know, they will tend to go to the health center when you feel where the government has stocked there with affordable medications. And then, you know, the nurse, the The community health worker sees and feels that, okay, I can manage this, I've been taught this, and then dispenses the right medications. She sees that, no, this is beyond me. She refers to the state, to the local government general hospitals. General hospitals that are now also well equipped does the needful. If they don't have the capabilities to do that, they refer to the teaching hospitals. In that way, things are properly done. You know, in that way, you and I will live longer. You know, now also, you know, with age, as we grow older, the more we have eye conditions, you know, and it is not only in ophthalmology, but I think it's in almost all spheres of health. As a person grows older, the likelihood of cataracts, glaucoma, age-related macular degeneration are likely. Short,
all these are age-related?
Yes. Hypertension, age-related. Diabetes is also age-related. You know, there are also adult onset diabetes. Are also the one that comes at a younger age. But you see, as you grow older, let me give you an example. A car you buy today, it's likely not to have much problem than a car that has been there for about 10 years. If it's not the carburetor, it is the exhaust. If it's not the exhaust, it's the battery. If it's not the battery, it's one thing or the other. You know, the older we get, the more likely we are to have eye conditions. So once the life expectancy increases, more people will come down with eye conditions.
This prevalence of eye-related issues, vision impairment, blindness, is it possible that regular eye checks can help control them, or must they happen?
Thank you so much. You know, we talked about 75% of blindness in sub-Saharan Africa are preventable. What you just said is the key. In all that we've said is the key, you know, to preventing. That you have glaucoma does not mean you will become blind. No, never. My mother has had glaucoma since the year 2000. You know?
That's 25 years.
That's 25 years. She's a nurse, so when she was told that drugs cannot manage her condition, that just surgery, she opted for surgery. You know, and she's doing well. She had a repeat surgery last year at 81, at 80. I mean, she's doing quite well, you know, because she took that advice, you know, to do surgeries.
Because now, she is aware.
She's aware. Now, we as people do checkups, see, our people feel that if the Igbo say, no one that it is when you go to the doctor that the doctor will put up a diagnosis. No. You know,
I must get something.
I must get something.
There must be results.
We were not like, no, the proper thing that we should have all checkups, you know, because glaucoma as a disease entity does not have an early symptom. And then when I go to radio stations and ask me, what are the symptoms of glaucoma? I say there are symptoms, but they come late. So if you're waiting for the symptoms, that means you will be diagnosed as somebody who has advanced glaucoma. But if you have constant annual checkups, not...
Okay, because I was going to ask you how frequent.
No, annually.
Okay.
For those who do not have issues, annually, once a year. You may choose a week after your birthday, a week before your birthday, you know, so that you don't forget, you know. You can do a week after your birthday so that you can run all the necessary tests you need to run. Apart from the eyes, you know, check your entire body. It will cost money, but it also saves life, you know. Now, let me give you a typical example. You know, when somebody knows there's if you notice a lump in the breast and you notice it fast and is removed, you know, two things. It is not malignant, that it is not cancerous, you know, and we all shout to God be the glory. And then we find that, okay, it is cancerous, which is an early catch. You start doing the needful. Currently, we're having an increase in number of cancer survivors because of early detection and checkups. Now, if you don't do a checkup, you will not know, you know, because by the time these diseases come, like most of the cancers that are very brutal, are because nobody does a checkup. And by the time they become symptomatic, give a patient a week or two, patient is gone. You know, because you feel, by the time you already know, the thing has gone beyond the tissue or the organ where it started from. You know, it has metastasized that moved to other places. And by the time, you know, you can't just manage it. This person dies. So, but if the person does a checkup, the person will be able to, on time, be able to find out this and do the needful.
Okay, apart from checkups, annual checkups, are there some symptoms that that will have to present itself and you'll be concerned to check the eye? Yes,
currently, you know, we tell people to always, you know, close one eye, look, close the other and look. And then for every symptom you have, see an ophthalmologist. For every symptom of the eye, see an ophthalmologist.
If suddenly you begin to have a scratch in the eyes, you should.
Yes. So no.
Nigerian.
Now you know. See, for you know, a normal eye can itch, and stop. A normal eye can have pain and stop. A normal eye can have funny body sensation and stop. A normal eye can turn red and stop. But what we're worried about are consistent symptomatic complaints. It has been there for 3 days, for a week. That means it's not just transient. Something is wrong, you know. But as per having small pain, having small, these are normal. But when they become, they've lasted long, then you are worried that, oh, this could be something else, and you want to sort it out. Okay, so somebody comes in with itching that could have been diagnosed as allergic conjunctivitis and given drugs, anti-allergic medications for it to go. And the person now says, okay, no, Mama Nkechi just delivered, let me go and take her breast milk. You know, and the person that produced Mama Nkechi for breast milk, please instill, you know. Or somebody now listens to one of his neighbors, you know, who has no job, who's stuck in trade, is to move from one street to the other street, hearing stories and concocting his own stories, making them up. And he comes to say, no more listen. Just use the early morning routine. It will go, you know? And the person...
Okay, there's one very common eye issue, at least in Nigeria. Okay. The inflammation of the eye, the one we call Apollo. Okay.
It's viral.
It's okay. But does it heal on itself without medication?
Yes, it can heal on its own. Most times they run their course and go because the viral conjunctivitis, you know, they come and they go. Now, what happens that those who go and start using salt water, sugar water, tend to have more, the symptoms get you know, more exacerbated, it gets worse. Because this is just a virus. We are going to load this virus with sugar. Fertilizer. It's just like a little light here. You go and pour fuel on it.
Are there extreme cases of Apollo?
Yes, there can be. What I going to do in Apollo is to ensure that the pain is taken care of. The inflammation, you know, that comes with pain and redness are, you know, well handled. Then you're putting antibiotics just to avoid secondary infections. You just kind of monitor the patient with the patient goes. Now, to make it worse, you now go and apply urine. Oh my God. Or go and put breast milk. Or go and put sugar water, you know, salt solution or sugar solution. No, these are very, very wrong things. Ideally, somebody says, when I have my bath, I finally open my eyes and wash it. No, that is quite wrong. The God who made us gave us tears. And those tears keep flowing. You know, they get well drained from the nasolacrimal duct, and they get absorbed. So he need not put anything in the eye. Those who put Otanjele should actually use it as cosmesis. That is, put it on the skin, out of the skin. Don't put it to the eye.
So what of the ones they apply on babies?
Yes, ideally, like I said, it's applied for cosmesis. Now, those Otanjele are more like lead-like substances. They can also incite allergy. You know, when they come, I tell them, madam, your problem has been this Otanjeli. Is put it on the skin now. Don't put it inside the eye. You know, it has no business being inside the conjunctiva. You know, so when they put it on the children, for the children to look finer, is that also? It cures nothing. You know, well, for the children to look more beautiful, more handsome, that's all.
But
You know?
there's some sort of discharge in the eyes of the children who...
No, we all have discharge, you know, like we have industrial environments. In the morning, when we sleep, all those discharge will come out here. In the morning, you just clean your face, you do the S1
Because I'm trying to see reasons with mothers that apply it on their babies. They think it's the...
Yes.
Clears the
that
eyes.
clears the
wrong.
eyes and brings out the...
It's quite wrong. You
discharge.
see, we've gone free in the days of yore, not now. We shouldn't do things that people should cry out, you know. People are, like I said about, you mentioned about the doggerlings or what? Dogger man, you know. A police officer had actually approached, came to the hospital, and his eyes were almost gone. And he said somebody was selling something in the bus. And said, this will clear your eye, make your eye this and that, you know, and he bought it. Now he's applied them. Now, where is the man who sold it to them? Nowhere. You now bought something to put in your eyes. For what? So I advise our people, your eyes should be, God has already taken care of the eyes. As per cleanliness, as per being bright. If you have issues, complaints, go and see a doctor. Don't go putting anything in your eye to make your eye look finer or look more brighter or comfortable. No. You know, if you see a doctor, he will tell you what to do. But trying to put anything else in your eye is grossly inappropriate. And we advise against anybody doing that. Whether holy water or whatever, just do not put in your eyes.
Interesting. Okay, looking forward, what areas of research do you believe that are more critical to understand and address the rising incidence of eye problems in Nigeria?
Well, the research areas are first our people. You know, we need to actually get to the community to talk to our people. You know, disabuse their minds of all beliefs, some religious beliefs that are not helpful, you know, and then tend to interact with them, you know, and then the most important thing here is creating appropriate awareness so that people will know what to do when there's a problem, you know, and know that they could be the source of their problem, you know, that what they do may actually cause their problem, you know. So there's so much areas for research in our environment. We've done one where we took our blood samples of our people out of the country, knowing why do we even have this glaucoma? Why do we have the worst prevalence? You know, and it was found that we had a particular gene among the Igbos that predisposes us to glaucoma than the other tribes in Nigeria. You know, so we also need to do more. You know, especially our people's. You know, you were asking about apart from the environmental, but also the way our people do things, you know. Lifestyle, you know. So we also talked to people about the issue of eating fresh food and fresh fruits. Don't say them to go and buy Coke or Fanta or buy Indomie. No. Eat them.
Those are brand names, by the way.
Yes. Eat them.
They have a generic...
Yes, please. Don't go and buy minerals. Let me just say minerals. So...
Or noodles.
Or noodles. Go eat them. You know, don't go selling them. Yes, you sell them because you need money, but they are far more nutritious than that which appears sweeter. You know, so our people should know that part of health is eating rightly. And if you eat rightly, you are likely to avoid having some eye diseases. You know, and we keep talking about fresh fruits, vegetables, and our natural foods. That some of these chemicalized food are not good for us. And then people should not go selling the proper thing. You can sell vegetable to buy yam, accepted, or to buy gari, accepted, or to buy beans, but not to go buy things we do not know what nutritional value they give us.
All right, that's a very, very, very educative conversation this evening with Dr. Obinna Shiweobi, consultant ophthalmologist with Alex Ekweme Federal University Teaching Hospital, Abakaliki, Ebonyi State. Thanks for coming.
Thank you so
Thank
much.
you so much.
Thank you so much.
We shall return for the second discussion segment in a bit.
Signature TV. News in your pocket.